Attempt 16 of my teen suicide speech, written by moi. Teen suicide has become an insane worldwide issue. It is the leading cause of death of teens from age 15 to 24. Teen suicide is devastating to everyone around them. Imagine someone close to you feeling so hopeless that they think the only way to stop it is to end their life. It sucks. Throughout middle school, I was in and out of mental hospitals for a variety of mental disorders and suicide attempts. It is the worst feeling in the entire world and is more common than you think. The numbers keep on increasing more and more. If we can all educate ourselves on this topic, we could drop them down drastically. The numbers for teen suicide are extremely high. 11% of teens aged 15 to 24 have tried to kill themselves, while 40% have thought about ending their lives. 25,000 teens a year are admitted to the hospital for harming themselves, whether that be through cutting their skin or drinking poison. There have been 33,289 successful suicides of all ages of U.S. citizens in 2006. Male suicides are much more common than females, coming in at 77.9% of all suicides, although females are more likely to have suicidal thoughts and ideations than men. Males usually use firearms to commit suicide, while females usually choose a type of poison or suffocation. Male suicides are more common only because they use a much more lethal way than females. Causes of teen suicide differ wildly amongst people. Depression plays a huge role in suicide rates, but other factors include eating disorders, drug abuse, sexual assault and rape, divorce of parents, trauma, financial problems, bullying, social rejection and social problems, anger and guilt, breakups, illness and disabilities, domestic violence, abuse, academic struggles, loneliness, insecurities, extreme mood swings, race discrimination, death of loved ones, and mental disorders such as bipolar major depressive disorder and schizophrenia. Eating disorders has the highest correlation amongst suicide rates than any other mental disorders. The suicide risk of teens with eating disorders is 15%. 90% of teenagers with thoughts of suicide believe their families did not care or understand them. 75% of all teens who committed suicide were depressed. Social media can be another factor to teen suicide. About 1,787 teens use 11 different social media platforms. This can become bad because there are lots of issues with cyberbullying, which can lead to extreme depression and thoughts of suicide. 13.7% of teens who had attempted suicide have reported cyberbullying. Most people are uncomfortable talking about suicide, but if you feel that your child may be thinking about it, it may be beneficial to ask questions like if they have been having feelings of depression or thoughts about ending their lives. Their answers may scare you, but to be gentle and understanding, ask them if they would be willing to talk to your therapist about it, and ask if they would be willing to go to a psychiatrist, possibly get some medications to help them. Don't yell at them or make them feel guilty for them feeling that way. Tell them that it's normal and understandable. Please be supportive and helpful to everyone who has thoughts of suicides. They aren't doing it for attention, they need help. To prevent teen suicide, to keep any firearms locked up where no one can get them, medications should also be locked up. Teens sometimes carry around medications and will sometimes trade them with others. Be careful with knives and razors. When I was first let out of the mental hospital, they told my parents to lock up anything sharp that I could use for self-harm. Today we have a wide range of effective treatments to help those with mental illness and thoughts of suicide. A range of antidepressants, lithium, anticonvulsants, psychotherapy medications to help treat anxiety and prevent psychosis. Lithium is proven to be the most effective with the prevention of suicide, but not everyone will respond well to it. Most medications can have troublesome side effects, so it's important to talk to your doctor to help find the right one for you. Lots of people who have mental disorders or are at risk of suicide may be admitted to a mental hospital. These are very helpful to some, as you are surrounded by people who are going through the same thing as you. Mental hospitals have lots of group therapy sessions, one-on-one therapy sessions and psychiatric sessions to figure out medications to best help you. They are under close watch of everyone around you to make sure you do not try and harm yourselves. Although mental hospitals can be amazingly helpful for some, others like myself, it can be traumatizing. I personally hated every second of being there. I still have nightmares sometimes of my stay at different hospitals and tried to block most of it out so you could be careful and understanding while making the decision to send your child to one. Therapy has been one of the biggest helps for me in my journey of mental health. Being able to get professional help with all the thoughts running through my head was amazing. My therapist helped me understand all the thoughts and fears and helped teach me a variety of coping skills to help me whenever I had bad thoughts. There are many warning signs you can watch out for to prevent teen suicide. These warning signs are indicators that a person may be in danger and needs urgent help. Don't ignore someone if they are talking about wanting to die or want to kill themselves. Other warning signs include looking for a way to commit suicide, talking about feeling worthless, talking about feeling trapped or being in pain, talking about being a burden to others, increasing the intake of drugs and alcohol, acting anxious or agitated, sleeping a little too much, withdrawing or isolating oneself, showing rage or seeking revenge, and having extreme mood swings. A suicide is tragic and complicated, but it can be prevented. Educating others and yourself about the risk factors and warning signs may prevent someone from ending their lives. Warning signs can be easily missed, so the more known we get them is the better chance we have of saving others and getting help they need it. If someone is displaying any of these symptoms, talk to them and call 911 or take them to a hospital. Do not leave them alone. Teen suicide is an ongoing, serious problem. If anyone you know is struggling with thoughts of suicide, reach out and get help. Try and talk with your friends and family and try to make them understand if they don't. Or call a suicide hotline such as 1-800-273-8255. Remember to be gentle with those who are suicidal. They need help and they are scared. Don't yell or make them feel unwanted. This can push them over the edge. Be careful and ask what you can do to help them. If someone you know has committed suicide and maybe talking to someone about it, you know it wasn't your fault. It was their choice. Don't ignore the signs. Make others aware so you can save someone's life. Sorry.